So this is Dr. Van Rieken at Reno Sparks MedSpa. I have a lovely volunteer here, Janice. Say hi, Janice.
Hi there.
All right, you're supposed to say hi, Janice. All right. She's here because she has some hair loss, and hair loss in women, hair loss in men is a little bit different. The pattern is different. And if you look at Janice here, she really has pretty much probably a similar hairline to what she had when she was younger, but it's thinner up here. Is that correct?
Yes.
Okay, whereas with men, for example me, you'll get a hairline going up higher. So one of the things I tell people is, and the women seem to do better with this procedure than men. They seem to get more hair growth with less procedures. It ends up costing them less. It isn't because I like women more, yes I do, but they're just cheaper to treat, and they're more likely to respond to one or two treatments. And men, usually I tell them, you're wasting your time if you don't at least go for a 3-pack, 3 different sessions. So what I find is that if you're going to inject this where there's hair, if there's no hair at all, the effectiveness of the treatment is kind of like not great. But if you've got some hair there already, but thinner, and let's say you increase it 30, 40, 50%, that's a significant cosmetic result, and people will look a lot better. So if we look over here, she's lost some of her hair, and so the idea with putting growth factors here is to make these hairs larger and also to make new ones grow. That will take some time. And right now her hairline's a little bit indistinct because she just kind of gets thinner and stays thin, and you're kind of trying to decide where it starts because it's thin. And if we can thicken that up, it will look more like it did years ago. How does PRP work? Well, this is what I call liquid gold. It looks kind of clear. But we draw her blood, we spin it down, and we keep some of the best parts. We take the parts of the plasma that are rich in platelets. Platelets have many growth factors, and that's what makes hair grow. It also works for wrinkles and stuff. So, are you ready?
I am.
Okay. There will be some pain with the procedure. We're injecting with 30 gauge needles. These are small needles, kind of like Botox needles. So I'm going to go ahead and start over here right around the hairline and then kind of go back. And I'm sorry, you said how many syringes total?
14.
14, okay. Well, some of them will hurt, some of them will hurt more than others. You'll find that, and they're going in pretty easy. You doing okay?
Yes.
If 10 is a horrible pain and 1 is just a wee bit, how much does the average poke hurt you?
2.
2? Okay. So why are we changing needles? It isn't for sterility because it's still her scalp. It's been clean. We're changing needles for a simple reason. We want the needle to be sharper so it doesn't hurt as much. People often compare the cost of a procedure to nothing, to the cost of doing nothing. But most people with hair loss aren't doing nothing. They're doing something. They may be using different products or getting their hair cut differently or something like that. So I think it's nice to compare what people are actually doing. If you look back here, many women have, and men, and almost all men have preserved hair in a large amount here. But her hair is thin back here too. So if you were going to do hair transplants and take from back here and move to the rest, it's kind of slim pickings. So I think that injection procedures of some sort like this are kind of where it's at for her. We're all done, and it hurt moderately. She said she had pain up to about averaging maybe 4 or 5 out of 10 with the procedure. We gave her a fair amount of product, more than we give a lot of people, but we wanted to get a nice result and put it all over. And once again, the female pattern of hair loss tends to be diffuse. It tends to start at the hairline, but the hairline stays the same, thins out. And then they tend to be thin all over, particularly from about here forward. And they get a lot on the sides too. A little different pattern than you see in men. So we'll see what this does for her, and she should look for results within about 2 months. This is Dr. Van Rieken for Reno Sparks MedSpa signing off saying stay good looking.